but they didn't compare to unvaccinated kids. This is the response that I receive anytime I post any studies on vaccine safety and effectiveness. So let's discuss. First, there are two main types of studies: experimental studies and observational studies. An RCT, a randomized controlled trial, is an example of an experimental study. And it's experimental because the researchers are controlling who's exposed, right? So who's getting vaccinated in this example. And when it comes to vaccines, it would be unethical to have one group of children not receive vaccines because we have a mountain of evidence showing that they are safe and effective. And by the way, when vaccines were first being developed decades ago, we did do true RCTs that were compared to saline or inert placebos. But once we established vaccine safety and effectiveness, it was no longer ethical to compare against saline placebos. So we still do RCTs, but we'll compare to other types of vaccines or other formulations. So our alternative would be an observational study, which means that the researcher is not controlling who does and doesn't get vaccinated, but just observing who decides on their own to get vaccinated and unvaccinated. The issue is that people who are unvaccinated might be different in ways that are impacting the outcome of interest. So maybe they have different access to healthcare, different education, socioeconomic status, or other health behaviors and decisions around other things that impact their health. Lots of factors that we know can impact whatever outcome it is that we're assessing. So to deal with some of those issues, these researchers out of Denmark published a study that was a natural experiment. They were interested in aluminum exposure because aluminum salts are sometimes added to vaccines as an adjuvant to help them be more effective, essentially. And so they wanted to study the effect of aluminum on our health. They looked at medical records for over 1.2 million children born in Denmark between 1997 and 2018. There were changes in vaccine policy that happened during those years that created a kind of quasi-randomization because children's aluminum exposure was determined by when they were born, their birth year, and not family's choice. The researchers calculated total aluminum exposure for each child and analyzed the full spectrum from 0 milligrams to 4.5 milligrams of aluminum, including over 15,000 kids who received no aluminum-containing vaccines. Now, the primary analysis followed kids from ages 2 to 5 when most childhood diagnoses occur, but secondary analyses actually extended this to age 8. And across 50 different health conditions and multiple statistical approaches, they found no evidence that higher aluminum exposure increased disease risk. And what's really compelling is that if aluminum truly caused harm, you'd expect a clear dose-response pattern, meaning more aluminum would have led to more disease. And instead, they found no relationship across this massive study. So claims that they didn't compare to unvaccinated kids completely misses the entire strength of this approach and also ignores the fact that the study did include over 15,000 kids who did not receive aluminum-containing vaccines. So this is both factually incorrect and reflects a fundamental misunderstanding of study design. But now you know better.